Hello, okay, so this is me in the doctor's room and we're about to start the ward round. So this is a medicine for the elderly ward. We have people who are frail, who are mostly over 75, some between 65 to 75 age group, but who are frail, have lots of different problems, complex things wrong with them, affecting their function, and that's really what geriatricians specialise in. So we would have about 12 patients in our ward. These people have come in either from their GP or via accident and emergency. They then go up to medical receiving where they get seen by a consultant, and then they decide what the best area, the best ward to look after them to meet their needs is, and then they can come down to us. So we do a consultant ward round twice a week. We have the junior teams will do the rest of the days. They'll review people. New people will come down. We'll work to try and get them better and to try and get them home. We do something in care of the elderly called comprehensive geriatric assessment, where we look at all the different factors, so their health problems, their social factors, their psychological things, their functional things, everything all together with all the different members of the multidisciplinary team, which we'll talk about later. And we then integrate a plan looking at all these different aspects. We'll pull that all together in order to get the best outcome for the patient. The good thing about that is that it's really holistic. So it's really individualised, personalised medicine, which is what I like so much about it. Here are the members of the team. Here's Laura, who's our CMT doctor. So she's a middle grade junior. Erin, who is our FR1, who's been with us for 8 months now because of the situation, which has been lovely. And Caitlin, who's here as a clinical fellow. So she's in between in terms of seniority. And we are going to go and do the ward round now and see the patients. So we'll all go around together. We use a computer, so I'll just show you the computer that we have here. Caitlin has here all the patient investigations, previous entries from last time they were in, bloods, demographics, everything is on the computer now, so you spend a lot of time as a junior doctor on the computer, but you will still spend a bit of time looking at old-fashioned case notes, which is what we write in when they're in the wards. I think the other thing to say is as a junior doctor there's a lot of admin, isn't there?
Oh yes.
Let me just turn it around. When I started I didn't know quite how much admin there was going to be. You spend a lot of time doing admin. And that doesn't actually change, you just do different kinds of admin. But it's important that everything is clearly documented. You can pass on to the next person so that the patient's care is recorded and can be picked up again by other members of the team safely. So that's why we do that. So obviously we can't show you the patients or the ward round for reasons of confidentiality, but at the moment we're all in PPE at all times, and we can explain some of the things we've seen on the ward round afterwards. So next I'm going to go and do the multidisciplinary team review. So one of the things we do with the comprehensive geriatric assessment that I spoke about is it is not just the doctors, it's also the multidisciplinary team. So we'll have the nurses, occupational therapists, a physiotherapist, we have a discharge coordinator, so they liaise with social work and how things are in the community, and we all meet once a week and we talk about each patient and what we've done with our assessment for the patient. We try and integrate everything that we're thinking together and come up with a coordinated plan. This multidisciplinary approach is really, really key in geriatric medicine and is, I think, very rewarding. It's nice to work with other people and be able to use their expertise. So that's what I'm going to go and do now, and hopefully I can introduce you to the members of the team.
Hi there, my name is Derek. I'm one of the physios on the ward, and my job is to help patients get mobile and assess how they're getting on their feet and how we can help them get back on their feet.
Hi, I'm Kelsey. I'm the occupational therapist on the ward. I'm part of the team that kind of makes sure that patients are safe to go home.
Hi, my name's Jackie. I'm one of the staff nurses here over at the Glasgow Royal Infirmary. We as a team work really well as a team. We look after our patients, we make sure everyone and everything are taken care of, make sure patients are taken care of, and part of the team we will be 100% behind anyone who would like to come and join us.
Hello again. So I'm now going to do some referrals. So this is when other wards would like an opinion from a geriatric doctor, and so we go and see the patients. It can either be because they're thinking they need some advice about kind of syndromes, falls, frailty, that kind of problem. It could be that they're looking for a bit of help with how we can get someone home, some complex discharge planning, so we'd maybe be able to advise on that. Or it might be that they are keen to take someone, or asking us if we could take them over to think about whether they need some rehabilitation. So we'd go and see the patients and then come up with a plan. So I will go and do that just now. The man I'm going to see, it sounds like it might be kind of more medical advice they're looking for, so I'll go and investigate and find out. So the referral was a gentleman who had quite a lot of neurological and psychiatric problems, but also chronic dizziness, medical reasons to explain some of those. So it could all be that, but he was on an awful lot of medications, which I wondered might be contributing, so have asked for a kind of a review of his medications to see if we can cut them down a bit. It's always worth thinking when we're looking at patients, are the treatments actually causing some of their problems? We call that iatrogenic, when medications or treatments cause problems for the patients, and it's certainly something we see a lot of. And as people get older and get more health problems, the health problems mount up, the treatments they get for these health problems mount up, and their bodies become frailer and less able to keep things in balance, less able to metabolize medications in quite the same way. We get more and more of these kinds of issues. So it's one of the key things we would always think about in geriatric medicine when we're seeing people. So I have now changed out of my scrubs. I just had a meeting with a colleague, one of the surgeons, about a kind of complicated lady, trying to work out a plan for her going forward. So we've had a bit of a chat about that, and that will go back to speak to the family and the patient. I have spent the rest of my afternoon doing some emails, chasing up on various management things, discharge summaries for the patients who've been in the ward, thinking about how the rota works from a good junior doctor point of view, and about some educational supervision for the junior doctors as well. So as you progress in your career, I guess less time is spent fully on the clinical things, and you get more different things, some of which are more routine, some of which are things that you can choose for things that interest you, that you might particularly want to do. So we all have our own areas of interest. You can get involved in teaching, in education, in research, in service redesign, lots and lots of different things that you can choose to do. Medicine's a great job to have from that point of view, because there's so much you can do with it. There's so many different things you could do. I had a bit of a chat with one of the junior doctors just to see if there's any tips that she would like to give, and she said, if you want to do medicine, then it's definitely a good thing for you to do. It's a great job, a great career, but make sure it's something you really, really want to do, because it has its moments of difficulty and of challenge. And if it's something you really enjoy, then definitely these are what makes it interesting. But if it's not really the right thing for you, if it's not something that you want to do for yourself, then maybe the difficulties will not be outweighed by the enjoyment you'll get from it. So it's a great career if it's the right career for you. And I think I would absolutely agree with that, and that'd be advice that I would give as well. I guess the other advice that I always give when I have school students up is related to that partially, and thinking about, with all jobs, things can go wrong, and because of the nature of medicine, when things do go wrong, it can be really upsetting and difficult. And I think for most doctors, that's the hardest part of the job, is when things don't go the way we would want them to for our patients. And people talk a lot about resilience, and of course the right support should be in place for people, but I think it's always worth thinking about the kind of person that you are, and whether that's something that you feel you would be able to to manage, to discuss. As peer support is so important, speaking to people, talking with your friends and colleagues and move on, or whether that's the kind of thing that would be very difficult for you, because there certainly are some difficult moments. On the more positive side, however, it is, I can't think what other job I would do that's a realistic option. It's great if you like working with people, you're interested in people, you're interested in science. It's always varied. No 2 days are the same. There's always going to be something different, always going to be something interesting. So many different ways that you can take it. The job satisfaction is great. There's no other job I can think of where you get quite the same degree of job satisfaction. People come to you and they say thank you when you've helped them, and that really is something that's very lucky for us to have, to get that degree of feedback and of instant feedback in our job. So have a good think about it, and if you decide it is the job for you, then all the best with your applications.